Hi everyone, Sarah Strackhouse here, and I'm here with Dr. Johnson. Dr. Johnson, how are you?
Excellent today, thank you.
Trying to avoid the rain?
A little bit, but so far I've been indoors.
Perfect.
And the roof doesn't leak, so
yeah.
We're in good shape.
Definitely. So tell me a little bit, today we are talking about strokes. Can you tell me a little bit about what are some signs and symptoms of a stroke? I feel like we all kind of learned this growing up, the basics, but for the life of me, I can't think of what they are off the top of my head.
Well, strokes involve the brain, of course, and so they're brain symptoms that you get. There's two kinds of strokes, basically. One is where a blood vessel ruptures or you fall and hit your head and then you get a bleed, which kind of causes the same thing where it's pressure on the brain. And the other is where you actually have a clot that goes to a part of the brain, and it's the blood clot. So the reason for this is that different vessels go to different parts of the brain and can cause different kinds of symptoms.
So are there ways that we should react differently with the two types of symptoms? Or is it kind of, if you see someone having a stroke with any of these symptoms, act?
Yes. If you're having the symptoms, we're going to talk about those.
Yeah.
Then you definitely need to go to the emergency room immediately.
Okay.
Because if it is a bleed, and it's bad, they need to get it stopped.
Sure.
Or if it's a clot, they can treat it within a certain amount of time with clot dissolving medication.
Okay.
But it has to be done rapidly. So the situation is if you have a blood clot that goes to the part of your brain that controls motor function, then you're going to have motor function difficulties.
Okay.
So you can't move your right arm or your left leg, or you can't talk, is if it goes to the speech area. Some people have vision problems where they lose vision either in one eye or another. That can be a very specific spot.
Sure.
So you need to go immediately to the emergency room, get it checked out to see what is happening. Causes can be all kinds of things, from blood clotting disorders to heart arrhythmias to hypertension, and that's more in the hypertension areas where you actually have a blood vessel rupture and then you get a bleed in that area. So the actual blood is in that area. So you need to make sure you're taking care of your medical problems so it doesn't affect your brain. So if you have hypertension, it's important to keep your blood pressure under control. Diabetics have microvascular diseases, so they're more prone to vascular problems, including in the brain. If you have clotting disorders, you want to make sure that you're taking your blood thinner medicines and staying on those and not missing it. And if you have questions, talk to your physician about it, because if your blood starts to clot, you can throw a clot to your brain.
Wow, that's scary. And so, what about the other? What about the other type of stroke? Are there different symptoms, or are they similar things? Speech and mobility.
Well, if you have a bleed and say it's from head trauma and you rupture a vessel and it starts to bleed inside your skull, then that is a space-occupying lesion, and it puts pressure on your whole brain and starts to shove it down through the base of your skull. Wow. And so then you get different kinds of abnormal behavior, can't think, and if it goes through, then it destroys the whole brain. So if it goes through the bottom of it. So you want to make sure that's taken care of first.
Sure.
And quickly make sure so if you fall and hit your head and you seem disoriented, definitely go to the emergency room. If you have trouble with thought processes, all of a sudden you have trouble with speech, those are all lower brain type activities, then you need to go immediately to get checked out. Same way with immediate hearing loss, because that can be a little stroke that affects that part of the brain, and that can be treated.
What are the differences between when some people say, and I just want to make sure that we have this here so that we can see, there we go, if people are commenting, but what about the difference between, you just had a mini stroke versus, a larger stroke, or is there a quantitative way to tell, how serious it is?
Yes. there are things that are a condition they call transient ischemic attacks, TIAs, where you'll get a spasm of the blood vessel and you'll get decreased blood flow to a certain part of the brain where that vessel spasms.
And it's technically a stroke?
Well, it is a transient stroke, so it can resolve. If it persists, then it turns into a stroke where there's been brain damage. And so that's, you need to be able to have someone look at that. That's where they do a CAT scan or an MRI on your brain and look at what the vessels are doing, figure out whether something really has happened or not. So immediate attention, as we've been talking about, is important to figure out what is that process. Now, once the immediate situation is over and everything's controlled, then what you were talking about, well, they'll say, well, don't worry about it, it was a TIA. But you have to go back and figure out, well, why is this happening? Do I have vessel disease from an underlying disease process like diabetes or hypertension, or are my nutrients off? Because you can have low magnesium, which can help create vessel spasm. So
that's where more research needs to be done. Well,
that's where more research done, but also you need to go to the doctor, figure out, what actually is my nutritional status. And I do that all the time. So I look at what the different nutrient levels are, what the inflammatory factors are, the underlying inflammatory factors, and then whether there's other underlying factors that may lead to having central neurological problems.
Absolutely. Wow. Well, if you're just joining in, we're here with Dr. Johnson with Johnson Medical Associates. We're talking a little bit about strokes. And I'm going to make sure I have this on here for comments available. All right. So one thing I did want to note, so if someone is having a stroke, or you think someone is having a stroke, what should you be doing? Is this something where you don't want to lift them, or is it just get them to the hospital in any way, shape, or form they can?
Well, typically you want to call 911. And 911 will show up very quickly. They'll assess the situation, and then they'll know how to handle it, because there's different ways to handle it depending upon what the situation is. So it's best to do that. If you aren't around where that is, then get them to the hospital as quickly as possible. Makes sense. In any fashion, because getting there is the biggest thing, but 911 can handle it.
They're more equipped for that type of that type of work. The other thing I wanted to ask, when you said the whole thing about maybe the left arm doesn't have mobility or something like that, how can you really tell the difference between if someone is having a heart attack versus stroke in that regard?
Well, stroke involves the brain and the neurological function. Heart attack is where you get decreased blood flow to the heart because of obstruction of the coronary arteries, either from a restricted area where you have coronary plaque, or where a plaque broke off, like a blood clot, and blocks off the whole artery. Again, getting immediately to the hospital makes sense because there's things that they can do immediately to resolve that. And so again, that makes sense. Now, with a heart attack, you may have left arm pain. You may not have left arm pain. Typically, you get a heavy type pressure on the chest, which feels like somebody's standing on your chest. But you can have silent heart attacks, and women are more prone to have fewer symptoms than men. So if something feels funny, you're not feeling right, and it feels catastrophic to you, by all means go to the emergency room and see what's going on.
Use your gut.
Use your sense about you and make sure that you're healthy, because to get something done sooner than later is very important in these situations.
So after you have a stroke, let's say after you go to the hospital, you're back home, how long does recovery usually take, or is it different for everyone?
That's a different process for everyone, because it depends how extensive it is, whether it was just a TIA or whether it was a small area that was affected or a much bigger area. Typically the whole process is that they'll admit you to the hospital, watch you, stabilize you, then determine just how big it is and what your care is from the stroke standpoint. Next week, you'll be talking to a specialist that deals with speech and stroke problems. Yeah. And Emily will talk about that whole process and what she does to help people that have had the speech area affected regain their speech. Right. There's occupational therapists that help with movement type things to help retrain the brain with it. Here at Johnson Medical Associates and Hyperbaric Centers of Texas, I use all those different people to help retrain the brain, but then we heal the brain with using hyperbaric oxygen. Oxygen under pressure in a hyperbaric chamber helps get oxygen to the tissues that have been deprived of oxygen like 10 times normal. Right. Wow. And then oxygen plus glucose is what the cells function off of. Yeah. And so it's been deprived of oxygen and it goes into a dormant state and not functioning well. We increase the oxygen and it goes through a healing process. Wow. So we actually try to heal the areas that have been damaged. Now, typically with a stroke, if there has been a blood clot to the area, there'll be an area of dead cells, and then there's a larger area of dormant cells or injured cells. Right. That's what we try to rehab and help get oxygen to those areas so those cells can start to function and heal, just like you would a wound in your leg. Yeah. And we use hyperbaric all the time. Hospitals use it, wound care centers use it to help heal wounds where there's been inflammation, tissue damage, poor circulation to the area. Using hyperbaric, that's oxygen under pressure in a chamber, breathing 100%, that it increases blood vessels to that area and oxygen to the area, so you do get healing and closure of the wound. It works the same way in the brain cells, you just can't see it. It's an enclosed area under the skull that is present. Same thing happens kind of with traumatic brain injury, where you have concussions. You get an area of damage of cells and they don't function well. Hyperbaric oxygen helps in that area. So like Joe Namath with his traumatic brain injuries from football, he went through a whole series of hyperbarics and is back functioning much, much better with memory and overall functioning. Right. So you get healing over a period of time. It works like rehab. It's not a one-time deal fixes it. It takes time for the cells to recover, takes time to new blood vessels, takes time for the healing. So it's a whole series of treatments and a process.
And you have those here, correct?
Correct, yes. I have an outpatient facility here at Johnson Medical Associates. It's called Hyperbaric Centers of Texas. And we treat people with all kinds of different injuries, but stroke is one of those. When they aren't progressing, they kind of reached a state of stability but stalemate, then it can help regain those cells that aren't being recouped at this point in time. In Europe, they treat stroke patients right away after stroke, just as soon as they can get them into a hyperbaric chamber.
It speeds things along.
Yeah, it recovers cells that have been damaged quicker. They haven't been injured so long, and so they get a much, much quicker recovery, and then the rehab goes better. So when you go stroke rehab, they got cells that are working instead of cells that are trying to work with in the rehab process. So like with the speech process, we'll see people here that say, well, I've gone through rehab and I'm not speaking very well, put them in hyperbaric, the speech pathologist worked with them, see a dramatic increase in their speech capability. And they say, well, man, I wish I did this 2 months ago. And so it makes sense to intervene earlier than later because you get more benefit from all the other ancillary stroke rehab modalities in treatment, whether it's OT, PT, speech type therapy.
And we'll be speaking with Emily in 2 weeks, right, during the next Live with Dr. J?
Yes.
And she will be talking a little bit about speech therapy and some of the ways to kind of recover after a stroke as well, correct?
Exactly.
All right. Can you tell me a little bit about her?
Well, Emily is a trained speech pathologist that has done this for quite a while, worked with different facilities around town, and well-versed in how to get the most out of rehab with speech training. So we're glad to have her here in the office as part of our team to help with the rehab.
That's wonderful. Dr. Johnson, I'm going to double check this to make sure here we don't have any unanswered questions. So can you tell me, is there anything else that you think people ought to know, or is there a way to contact you if people have any questions?
Well, people can contact us through our website. Johnson Medical Associates or Hyperbaric Centers of Texas has a little place where you can click on, send us an email asking questions about it. You can call our office at 972-479-0400 and ask questions. They're happy to set that up. Just from a comment standpoint, hyperbaric is easy to do. It takes expensive equipment,
right,
but the person does not have to do anything. So whether they have some paralysis, have trouble transferring, you just lie on a cot, and that cot slides into the hyperbaric chamber, and it's pressurized, and you breathe at 100% oxygen under the pressure, and you just lie there, and it works.
So you can take a nap.
Yeah, you take a nap, watch
Perfect.
TV. The whole process is not pushing oxygen through the skin.
Mm-hmm.
You breathe it in through your lungs, and it fully saturates the blood vessel. And so instead of just the red blood cells carrying oxygen, which we normally do sitting here talking, and we stay about 97-95% saturated, the hemoglobin becomes fully saturated, but then the whole serum is saturated with oxygen.
Right.
And that's how you get the increased delivery to the tissue. Wow. And it's really a beneficial way for healing to occur.
Yeah. How long do you go in there for?
Depends on what protocol we're using, but typical a stroke protocol is 60 minutes twice a day.
Oh, wow, okay.
And we get through 40 hours worth, reevaluate. It takes that amount of time typically for the cells to begin healing, new blood vessels to form if they need to be formed,
right,
and also it helps the body detoxify at the same time.
Yeah. Oh, wow, that sounds so interesting. And you know what? It sounds kind of nice to be able to just relax and breathe nice, good oxygen, right?
Sure. Have you been in there?
I have not. Maybe I'll have to try it out.
Let's try it out.
Yeah.
Just from a health standpoint.
Yeah.
It helps your brain function, it helps detoxify, it helps the cells function better. So
I could use all of those things. Perfect. All right. Well, Dr. Johnson, one more time, your phone number and where people can go to ask questions online.
The phone number is 972-479-0400. The online, you can go to johnsonmedicalassociates.com or hyperbaric-centers-of-texas.com.
Perfect. All right, and don't forget to join us in 2 weeks at 1 o'clock. We'll be live again, this time with Emily, talking a little bit about speech pathology. I probably need some of that. And we'll ask her, anything you want to know. So hopefully you continue to ask questions here, because we'll continue to answer those questions also in weeks to come. So we hope you enjoyed it. Have a good one.
Thank you.